Now let's talk about Zhang organs, the liver. Promoting transportation and transformation of spleen and stomach. The function in governing transportation and transformation of spleen and stomach is closely related to the function of the liver governing free coursing. The normality of livers governing free flow of qi serves as an important condition for normal ascent and descent of qi of spleen and stomach. And the liver and spleen stomach are located in the middle burner. Transportation and transformation of spleen and stomach are based on the coordination between the ascent of spleen and descent of stomach. It can promote the functions of transportation and transformation of spleen and stomach. As the liver functions abnormally in governing free flow of qi, it will not only affect the spleen in ascending the clear, which manifests as dizziness and diarrhea, but will also affect the stomach in descending the turbid, which manifests as hiccup and vomiting, epigastric distension, and fullness or constipation. Secretion and excretion of bile is controlled by when the liver functions normally, the bile will be normally secreted and excreted. If the liver dysfunctions in governing free coursing, it will affect the secretion and excretion of bile, resulting in pathological changes of bitter taste, jaundice, and pain in the hypochondriac region. When the symptoms of dyspepsia due to the gallbladder disorder are presented in the clinical settings, the principle of coursing the liver and promoting the gallbladder is often applied. Regulating the ejaculation in men and menstruation in women. The normal function of ejaculation in men and regular menstrual cycle in women are related to coordination and balance between the function of liver governing free coursing and the function of kidney storing essence. When the liver courses flow of qi normally, sperm can be discharged smoothly and moderately in men, and menstruation is normal in women. If the function of kidney storing essence is normal, there will be normal menses and ejaculation. When liver qi fails to regulate and becomes congested, in women it will result in delayed menstruation, dysmenorrhea, and even menopause. In men, it will result in low libido and difficulty in ejaculation. If the liver qi ascend upward too much, it will result in early menstruation or excessive menstrual bleeding in women and libido hyperactivity or spermaturia. The liver storing blood is first seen in menstrual regulation of Suen and Benshen of Ling Shu. This function implies that the liver has capability to store blood and regulate blood volume in circulation. Storing blood includes two aspects. First, a certain amount of blood is stored in the liver. The blood nourishes the liver itself to prevent yang qi of the liver from hyperactivity. On the one hand, dysfunction of liver in storing blood will lead to blood deficiency in the liver. And on the other hand, it cannot void liver yang from rising too much and will lead to ascending hyperactivity of liver yang, liver fire flaming upward, or liver wind. Second, liver storing certain amount of blood can prevent bleeding. Dysfunction of liver in storing blood will lead to various bleeding disorders such as epistaxis, metorrhagia, or vomiting of blood. The liver regulating volume of blood is first seen in the chapter of Wu Zhang Sheng Cheng Lun in Suen. It said, when a person is in a sleep, the blood will be back to the liver. Wang Bing, a famous doctor in Tang Dynasty, explained it as follows. Liver stores blood while heart governs blood circulation. When a person is inactive, the blood moves into the vessels. And when a person is in quiet, the blood goes back to the liver. Blood volume of different parts of the body can adjust itself based on emotion or surrounding. Peripheral blood volume increases when a person is in an active state, and blood stored in the liver is transported to the exterior to support physical functions. The peripheral blood volume decreases when a person is in quiet state, and the peripheral blood goes to the liver and gets stored in the liver. The liver plays an important role in regulating the blood volume, especially peripheral blood volume. It must be pointed out that the liver regulating blood volume is based on the liver storing blood. Only when the liver blood is abundant can the liver regulate the blood. Therefore, when the liver is deficient of blood, it will lead to the syndromes of blood deficiency in the whole body. For example, when liver cannot nourish the eyes, it will lead to dry eyes or night blindness. When liver cannot nourish the tendons, it will lead to contracture of muscles and numbness of limbs. When it cannot nourish Chong and Ren meridians, it will lead to scanty menstruation or even amenorrhea. Therefore, liver's governing free coursing is closely related to the function of the liver storing blood volume. Liver can transport the blood to the exterior, which is actually the manifestation of the liver governing free coursing in promoting blood circulation. Liver regulating blood volume is based on the function of the liver governing free coursing and storing blood. Thank you so much for your attention.
Let's now discuss tinnitus as we continue with interviewing. Tinnitus is caused by either failure of qi to rise to the ears in empty type or an excess of qi in the ears in full type. In order to differentiate between the empty types and the full types, we need to consider the onset, pitch, duration, and reaction to pressure of the tinnitus. A sudden onset suggests a full condition which may be internal, such as liver fire or liver wind, or external, such as heat in the lesser yang. A gradual onset suggests an empty condition which may be due to a deficiency of the kidneys, lung, or heart. A loud, high-pitched ringing noise like a whistle indicates liver yang rising, liver fire, or liver wind, whereas a low-pitched noise like rushing water is indicating a kidney deficiency. Tinnitus of short duration is usually due to an external invasion of wind heat affecting the lesser yang channels, whereas chronic tinnitus of long duration is due to either a kidney deficiency or a liver pathology, be it liver yang rising, liver fire, or liver wind. If the tinnitus is aggravated by pressing one's hand on the ears, it suggests a full condition. If it is alleviated, it suggests an empty condition. So to summarize, tinnitus, tinnitus with sudden onset and alternation of chills and fever, it indicates lesser yang pattern. A tinnitus with sudden onset and headache, it indicates liver fire or liver yang rising. A high-pitched tinnitus means liver fire or liver yang rising. A low-pitched tinnitus indicates kidney deficiency. Chronic severe tinnitus indicates liver fire, liver yang rising, or liver wind. A chronic mild intermittent tinnitus indicates kidney deficiency. And a chronic mild intermittent tinnitus with palpitations and weak voice indicates deficiency of heart and lung qi. In kidney deficiency, tinnitus and or deafness comes with gradual onset, and tinnitus is characterized with low rushing sound and is accompanied by dizziness, backache, tiredness. Other symptoms and signs include those of tongue and pulse, depend on whether there is kidney yin or yang deficiency. For acupuncture, we can use REN4, kidney 3, and bladder 23. In kidney yin deficiency, tinnitus and or deafness comes with gradual onset, and the tinnitus is characterized with, tinnitus in liver yang rising. Tinnitus and or deafness with tinnitus characterized with a high-pitched sound, comes with headaches, dizziness, irritability, and a propensity to outbursts of anger, red face, and a wiry pulse. In acupuncture, we can use liver 3, gallbladder 20, triple burner 5, gallbladder 43, triple burner 17, and gallbladder 2. Thank you for your attention.
Diagnosis according to 8 extraordinary vessels: Du-mai, Ren-mai, Chong-mai, and imbalances. Symptoms and signs: aches, pains, weaknesses, or problems along the path of the vessel, especially pain in the spine, tailbone, and neck. Imbalances along the spine, headache, nasal problems, seizures, convulsions, and tremors, hemorrhoids, rectal prolapse, tinnitus, fever, and aversion to cold, manic behavior, depression, superficial and long pulse in the left hand pulse positions. Acupuncture treatment: SI3, UB62, local, distal, and tender points along the course of the Du-mai. Ren-mai imbalances. Symptoms and signs of these are soreness, weakness, pain or problem along the path of the vessels, especially pain in the abdomen, chest, and neck, infertility, irregular menstrual periods, amenorrhea, hot flushes, night sweats, and urinary disorders, involuntary ejaculation, accumulation in the abdominal cavity, thin, tight, and long pulse in both tune positions. Acupuncture treatment, lung 7, kidney 6, should be local, distal, and tender points along the course of the renmai. Chongmai imbalances. Symptoms and signs are aches and pains, weaknesses, or problems along the path of the vessels, especially pain in the abdomen, uterus, and the chest, irregular menstrual periods, dysmenorrhea, clotted menstrual blood, PMS, purple painful spots around the mouth during and up to the menstruation, restlessness or turmoil rising up from the abdomen to the chest and the neck, running piglet chi, anxiety, shortness of breath, nausea and vomiting, infertility, palpitations, muscular atrophy in the legs, warm sensation in the face. Cold and purple feet, hot flushes and night sweats during menopause, deep and confined pulse in both guan positions or in all positions on both sides. The pulse may also be wiry on both guan positions. The acupuncture treatment should be spleen 4, pericardium 6, should be local, distal, and tender points along the path of the chongmai. Thank you for listening.
Diagnosis according to 4 levels. We discuss heat in the stomach and intestines. This pattern is basically the same as the Yang Ming stage in the 6 stages, and the pathomechanisms will be the same. Etiology, exposure to exogenous pathogenic qi, which has either invaded the qi level directly or penetrated down the wei level. Symptoms and signs. Constipation or green watery diarrhea. This is false diarrhea caused by a blockage in the intestines, abdominal bloating and distension. The pain is aggravated by pressure. Fever, especially in the afternoon, but no aversion to cold. Profuse sweating, mental confusion, restlessness, frontal headache, bleeding gums, red face, red tongue with a dry and yellowish coating, rapid, full, flooding pulse. Key symptoms: constipation, bloated abdomen, fever, rapid and flooding pulse. Treatment principle: drain heat from the stomach and large intestine. Acupuncture points to choose from: LI 11, SJ 6, stomach 25, stomach 34, stomach 37, stomach 44, UB 21, UB 25, and 214. Needle technique is draining. Do 14 can be bled. LI 11, SJ 6, stomach 25, stomach 37, and UB 25 drain heat from the stomach and large intestine and activate qi in the intestines. Stomach 34, stomach 44, and UB 21 drain heat from the stomach. Do 14 drains the G level heat. A person with stomach and large intestine heat should eat foods that are cooling and moistening. They should avoid foods and beverages that have hot energy. Stomach and large intestine heat can be caused by wei level heat and can result in yin level heat, blood level heat, and stomach yin deficiency. Thank you for your attention.
Let's go to combining points principles, balancing front and back. Generally speaking, it is not necessary to balance front and back within one treatment. The front points are usually used in acute cases, while the back ones are used in chronic cases. However, this distinction is by no means absolute, and both sets of points could be used for acute or chronic cases. In chronic cases, it is often necessary to treat both front and back points. In particular, in very chronic conditions, it is nearly always necessary to use the back transporting points at some time during the course of treatment. If treatments are given frequently, that is 2 or 3 times a week, one can alternate points on the front with those on the back within each treatment. This is a good way to balance the front and back. If treatment is given at more infrequent intervals, points on both the front and back can be used during one treatment. If both back and front points are used in the same treatment, it is better to start with the back points. Balancing the front and back points can be useful to correct an excessively strong reaction to a treatment. Supposing one has used several back points during one treatment and the patient experiences a fairly strong reaction, whether the treatment was the right one or not, it could be corrected by using points on the front in a successive treatment. This method applies to all other categories of balancing mentioned. If a patient experiences a strong reaction, one can analyze the point prescription and use and see if it was imbalanced in any way. For example, too many yin or yang points, too many front or back points, too many points on the top or bottom, or too many points on the left or right, or too many distal or local points. If the point prescription appears to be unbalanced, one can balance it appropriately using the opposite type of points. Thank you for your attention.
Let's now proceed to diagnosis according to Zhang for organ patterns with the continuation on pathology of spleen imbalances. People who are spleen qi deficient will often have a craving to eat things that are sweet. This is because the sweet flavor tonifies the spleen. Therefore, the spleen being qi deficient will cause the body to crave the sweet flavor in an attempt to tonify the spleen. The problem is that most people react to this signal by consuming sweets, chocolates, cakes, and other things that are very sweet. The sweet flavor here is very concentrated, so much so that the spleen can have difficulty transforming it, resulting in dampness and thereby a further weakening of the spleen. This gives rise to a new craving for the sweet flavor to tonify the spleen, and a vicious cycle arises. As well as the appetite being reduced when there is spleen imbalances. The resultant dampness means that there will be an increased amount of fluid, which can result in reduced thirst. The person can forget to drink. The problem is that dampness is a form of pathogenic qi, and being a pathogenic qi, it has none of the moistening, lubricating, and cooling qualities that qi has. When there is damp heat, the paradoxical situation can arise in which heat causes the person to be thirsty, but the damp aspect means that the person does not feel like drinking. Because damp is a condensed form of body fluid, there can be a sticky sensation in the mouth. When there is damp heat, there can also be a bitter taste in the mouth if the heat aspect is intense. If the spleen is not able to perform its function of transforming and transporting fluid in the body, edema can arise. The edema will be chronic and it will often be aggravated by consuming certain foods. Moreover, the edema can also arise in premenstrual period if stagnant liver qi invades the spleen. Other symptoms and signs that liver qi is invading the spleen in the premenstrual period are abdominal bloating and distension, a craving for sweets, and loose stools. As mentioned, dampness and phlegm can arise as a consequence of spleen qi deficiency. This can result in a tendency to put on weight. Dampness can manifest with the person developing a pear-shaped body because dampness seeps downwards to the lower jaw due to its yin nature. It is very typical for women to develop this type of body shape from age 35 years onwards. Because when women enter the 6th qi cycle, women decreases in intensity. At the same time, their spleen qi is decreasing in strength because it has been working hard for 21 years to replenish the blood that has been lost through menstrual bleeding. Men do not start to gain weight due to the decrease in women until they are 40 years old and enter their 6th qi cycle. Also, because men are more young, the weight gain sits higher up around the belly. Spleen qi deficiency does not necessarily lead to a gain in weight. Spleen qi deficiency can also be a cause of weight loss in a body that is too lean. The reduced production of blue qi that is a consequence of spleen qi deficiency can lead to qi deficiency and blood deficiency, resulting in the muscles and tissues not receiving sufficient nutrition. A person who is qi deficient will often have a slightly pale face, because there can be a genuine lack of blood due to the reduced production of blue qi and not enough qi to carry blood up to the face. When there is dampness, the face and possibly also the eyes can have a yellowish tinge or hue. Constant worrying, speculating, ruminating, and thinking too much in general will stagnate and bind, thereby ultimately weakening the spleen qi. Conversely, if the spleen is qi deficient, this can manifest with a tendency to worry excessively or unnecessarily, the person also having difficulty in letting go of thoughts. This is because they are not able to transform information and extract the relevant from the irrelevant. Their E stagnates and they can start to think in rings. In extreme cases, this can become obsessive, as in obsessive compulsive disorder or OCD, or it can become a depressive condition. Spleen qi deficiency can also result in a person having difficulty studying and learning, and this is especially noticeable if there is damp phlegm, because it will cloud the shen and the person will have difficulty concentrating. It will feel as if their head is full of cotton wool or there is mental fog. Furthermore, the reduced production of wu qi can lead to blood stagnation and the brain not being nourished by hard blood. General symptoms and signs of a spleen imbalance. There's fatigue, especially after meals, loose stools, poor appetite, and a tendency to gain weight. Thank you for your attention.
Diagnosis according to Jin-Ye imbalances. Jin-Ye deficiency. Jin-Ye imbalances include patterns where Jin-Ye is weakened or stagnated, but also patterns where Jin-Ye has transformed into dampness or phlegm. Jin-Ye deficiency, more than being a pattern in itself, Jin-Ye deficiency is involved in and is a consequence of other imbalances. Jin-Ye is an aspect of yin. Yin imbalance and Jin-Ye imbalance are like the chicken and the egg. They often lead to one another. The lack of the body fluids means that the body dries up, and this injures yin. There will be symptoms and signs such as dry mouth, dry lips, dry throat, dry skin, dry cough, constipation, and scanty urination due to the lack of moisture. The tongue will be thin and dry. The pulse will be fine. Etiology. Imbalance can arise when there has been profuse sweating, acute heat in the body, as in high fever, chronic heat imbalances, bleeding, blood imbalances, frequent and heavy urination, vomiting, and diarrhea, as well as excessive consumption of spicy food or medicine that has a spicy dynamic. Symptoms and signs: dry mouth, dry lips, dry skin, dry eyes, dry throat, dry cough, dry nose, dry mucous membranes, scanty urination, constipation, thin and dry tongue, fine pulse. Key symptoms: dry mouth, dry eyes, dry throat, dry mucous membranes, and dry tongue. The treatment principle is to nourish the Jin-Ye. Acupuncture points: choose from lung 7, kidney 6, spleen 6, Ren 4, and Ren 12. Technique is to tonify. Explanation: lung 7 and kidney 6, open Ren Mai and Ying Xiao Mei. Spleen 6, Ren 4, and Ren 12 nourish stomach and kidney. Relevant advice: as well as following the appropriate advice that is relevant for the underlying patterns of imbalance, a person who is Jin-Ye deficient must also make sure that they consume adequate fluids, avoid drinks that are diuretic, and avoid sweating. Jin-Ye deficiency can be caused by the following patterns of imbalances: yin imbalance, Qi heat, imbalance heat, blood imbalance, stomach fire, and stomach yin imbalances. Jin-Ye imbalance can result in the following patterns of imbalances: yin shu, shui shu. And thank you for your attention.
Diarrhea diagnosis. Acute diarrhea with exterior symptoms such as fever and aversion to cold indicates invasion of damp cold or damp heat. Foul-smelling diarrhea accompanied by abdominal pain and borborygmi indicates retention of food. Chronic diarrhea with abdominal distension, bulging, and flatulence, fluctuating with the emotional state, indicates that liver qi is invading the spleen. Diarrhea with frequent bowel movement and stools, sometimes like water, indicates long-term deficiency of stomach and spleen. Early morning diarrhea with abdominal pain and borborygmi during the bowel movement with a feeling of cold indicates kidney yang deficiency. Pale yellow stools indicates liver and gallbladder damp heat. Very dark stools indicate heat. Very watery stools indicate cold. Foul-smelling stools indicate heat, whereas absence of a strong smell may indicate cold, or of course, normality. A burning sensation in the anus during the bowel movement indicates heat. Abdominal pain that becomes worse after diarrhea indicates a deficiency condition, whereas if it lessens after diarrhea, it denotes an excess condition. Now let's go to identification of patterns and treatment. According to the aforementioned diagnostic guidelines, the most important differentiation to make is that between excess and deficiency and cold and heat. For full patterns, we discuss retention of cold dampness, retention of damp heat, retention of food, liver qi stagnation, blood stasis in the intestines. For the empty patterns, we have spleen and stomach deficiency, spleen and kidney yang deficiency. Explosive diarrhea would indicate an excess pattern. Acute condition is an excess pattern. Chronic condition is deficient pattern. Passing of stools shortly after eating would mean spleen qi deficiency. Passing of watery stools early in the morning, kidney and spleen yang deficiency. Burning sensation in the rectum and sticky, strong-smelling stools, damp heat. Watery stools containing undigested food particles, yang deficiency, excess cold. Cramping pain that is alleviated by the passing of stools is liver qi stagnation. Sticky stools, damp heat. Bloody diarrhea, damp heat, toxic fire. Pain or tension that is alleviated by defecation is liver qi stagnation, damp heat. Stools containing mucus is damp phlegm. Flatulence without odor, liver qi stagnation, or spleen qi deficiency. Flatulence, which is odorous, is damp heat. Intestinal discomfort that is alleviated by the passing of stools, excess conditions. The condition is aggravated by consumption of alcohol, fried food, dairy products, sugar, and dried fruit, damp heat. The condition is aggravated by consuming salad, raw vegetables, fruit, cold foods, dairy products, sugar, sweets, and dried fruit, spleen qi deficiency, spleen yang deficiency, dampness, alternating diarrhea and constipation. Normal stools would be liver qi stagnation. Condition improves after the passing of stools. Excess conditions. The condition worsens after passing of stools. Deficiency conditions. Thank you for your attention.